We are live. So, good afternoon, everyone. It's great to see you all. And it's a beautiful day outside, isn't it? Yeah. So this is voting list number 15. It is Tuesday, April the 4th. This is the Health and Government Operations Committee. And we got off the floor. We have to go back at 2. So we're going to start with concurrences, and Lindsay has 3 of them. And for the new members, Lindsay, can you explain what that is? We have 8 new members.
So these are House bills that were amended in the Senate. So we either concur, we agree with the Senate amendments, or we don't concur.
Okay. And she's going to tell us what they are, okay?
So the first one is for House Bill 63. This is the Certified Local Farm Enterprise Program. The Farm and Fish Program is what becomes under the bill.
You don't have that information.
No,
Usually you don't get that information.
It's not on the list.
Okay, it's not on the list because you already voted on it. She's just going to tell you what the differences are, okay?
The amendment from the Senate is a technical change correcting the name of the Senate EEE Committee.
Okay. Move to concur. There's a motion. Is there a second? Any concerns? All those in favor say aye. Aye. Any opposition? Seeing none, we concur.
House Bill 242 is a massage therapy bill on the definition of massage therapy and the insurance reimbursement. The amendments from the Senate also extend by 1 year the date after which the State Board of Massage Therapy Examiners may no longer issue a registered massage practitioner credential. This conforms it with the Senate bill, which you all already voted on, and this was a issue that was raised after the bill had already passed out of the House.
All right, it's been moved in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? None. Let's move.
And House Bill 611 is the bill on the Board of Nursing. It extends their sunset date and puts the MDH in charge of the Board of Nursing for 2 years. The amendment from the Senate requires the Executive Director of the Board of Nursing designated by the Secretary of Health during the period that the Secretary has authority over the infrastructure operations of the Board to be a registered nurse. So this is a current requirement for the Executive Director now. The bill, as it passed out of the House, would have removed that requirement so that MDH could appoint any executive director, and they're retaining the requirement that that person be a registered nurse. And the sponsor of the bill, Senator Kelly, agreed with the amendment, and it came originally from the Nurses Association.
It's been moved?
And we're concurring.
In second. Moved in second. Any questions or concerns? Yes.
Remember, it was discussed, that same issue was discussed. Can the chair of the committee or the subcommittee just, we discussed it and didn't do it, I'm just.
So what we did is we retained the requirement after the period of time that MDH no longer has authority over the board, that it would stay as current law is now. But for the period that MDH had control over the board, it didn't specify any particular qualifications for that person. And now this requires that that person be a registered
For those
nurse.
2 years. And you know this is a really important bill, right? Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, thank you. And you know, for those 2 years, the Maryland Department of Health is going to pay the $10 million that it takes. It's not going to come out of the fees for the board. Like, this is really important, right? So thank you all for your support. So let's go on quickly to House Bill 627, and that is Lindsay and Delegate Kerr.
Do you want to do the withdrawal first?
Oh, actually, we have, is it one withdrawal? Yes, one withdrawal. Is there a motion? Okay, it's been moved in second. Any concerns? All those in favor say aye. Aye. Any opposition? Seeing none, it's been withdrawn. Thank you, Delegate Kaiser. House Bill 627, Lindsay and Delegate Kerr.
This is an emergency bill that alters the membership of the West North Avenue Development Authority, also known as WNADA, and generally exempts WNADA from state procurement law. WNADA is still subject to written policy and procedure requirements for exempt units and the state's Minority Business Enterprise Program. There are amendments on page 1 in your packet. This is a reprint of the cross-file Senate Bill 331, so these 2 bills will be amended identically. The amendments add 2 members of the members to the membership of WNADA appointed by the chair, alters the date WNADA must submit its comprehensive report, requires that report to include procurement activities, and requires the report to go to the HGO Committee, and specifies that the procurement exemption in the bill terminates September 30th, 2026, regardless of whether WNADA is extended beyond that date.
Okay, and so it has a sunset, okay, for 3 years. This was a compromise. Delegate Kerr.
Thank you, Madam Chair. Everybody's good with the amendments? The vote in subcommittee was unanimous, and I moved the amendment.
It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, on the bill as amended. It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. We're now going to, let's just do the other one. Senate Bill 331 is the same bill. The amendments have been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, on the bill as amended. It's been moved and second. Any questions or concern? Seeing none, all those in favor say aye. Any opposition? Seeing none, it passes. Let's go to Senate Bill 681.
The bill establishes a Recovery Residence Grant Program and MDH to award competitive grants to recovery residences,
House Bill 681.
House Bill 681, to award competitive grants to recovery residences to support operations, services, and programs. In fiscal 2024 through 2027, the annual budget bill must include an appropriation of $500,000 for the program. There are amendments on page 6 that conform the House bill to the Senate cross-file. The bill as introduced would only have authorized level 2 recovery residences to be eligible for grants, and the Senate bill expanded those to level 1, 2, and 3 recovery residences.
Okay, that is Delegate Bagnall.
This was unanimous, and I would move the amendments.
It's been moved and second. Any questions or concern? Seeing none, all those in favor say aye. Any opposition? Seeing none, on the bill as amended. It's been moved and second. Any questions or concerns?
Amendment, so that's just a typo.
Oh, it's just a typo.
Yeah, okay.
Yeah, it's okay. It
Okay.
happens. It happens. We've been doing great. So the bill has been moved and second with amendment. All those in favor say aye. Any opposition? The bill passes. Senate Bill 7, I'm sorry. Yeah, let's do
And
558.
558 would be favorable. Because you amended the House bill too.
558 has been moved and second. Any questions or concern about House Bill 558, which is the same as House Bill 681? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. On 681, yes. Yeah, it's favorable with amendment, so you can. Who does not want to be on that bill? Everyone wants to be on it. 681, which is the residence, Recovery Residence Grant Program. Okay, thank you. Okay, beautiful, wonderful, thank you. So let's move on to House Bill 786, which is favorable with amendment. Lisa.
This bill authorizes a nursing home that contracts with or uses an electronic health network or electronic medical record vendor to direct the vendor to release patient medical records or electronic healthcare transactions to a business associate of the nursing home. There is an amendment on page 9 of your packet that corrects a federal reference that defines business associate.
Okay,
Madam Chair,
yes.
this was unanimous in committee based in significant measure on an AG letter saying that this does not conflict with federal law, number one, and number two, a letter of support for the bill from the Healthcare Review Commission.
Okay.
Move the amendments.
It's been moved and second. Any discussions about this? Seeing none, all those in favor say aye. Any opposition? Seeing none, on the bill as amended.
Bill is amended.
It's been moved and second. Any concerns or discussion? Seeing none, all those in favor say aye. Any opposition? Seeing none? All right, who does not want to be on that bill? Can you raise your hand if you don't want to be on that bill? Okay, Riley. Shalega. All right. Let's go on now to. Yes, let's do it.
That is Senate Bill 648. There are amendments on page 12. They strip the Senate amendments and make that technical correction to the federal citation.
So it conforms it to what we just voted.
And the Senate sponsored one of the
All right, so the bill has, the amendments have been moved Is there a second? Any questions or concerns about the amendment that have been moved? Seeing none, all those in favor say aye. Any opposition on the bill as amended? It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, let's go on now to House Bill 1189. That is Lindsay and Delegate Kerr. Do I have a different page? Which one is it? Oh, I'm so sorry. 876. I apologize. She did give it to me. You did. It's my bad. Okay? So let's go to 876, Maternal Mortality Review Program, favorable with amendment. Aaron.
There's a reprint of the bill on page 7 of your packet that reflects the amendments that were adopted in Public Health and Minority Health Disparities Subcommittee. The bill as amended requires a healthcare provider or healthcare facility to provide a local maternal mortality review team on request of the chair with prompt access to all relevant medical records associated with the case under review by the Maternal Mortality Review Program without undue delay.
Okay, that's Bagnell. Delegate Bagnell.
These were consensus amendments that Delegate Lewis helped to create, and I would move the amendments.
All right, it's been moved in second. Any questions or concerns about the amendments? All those in favor say aye. Aye. Any opposition on these amendments? Seeing none on the bill as amended.
Move the bill as amended. Second.
It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, who does not want to be on the bill? Everyone wants to be on the bill. Great. House Bill 1180, the cross file? Which one is the cross file? 644. All right, so let's go to Senate Bill on the second page, 644. Aaron.
Senate Bill 644 has been amended to be identical to its cross-file House Bill 681.
All right. Amendments have been moved in second.
Oh, I'm sorry. 876.
Okay, thank you for correcting the record. And thank everyone for your help. All right, so the amendments have been moved in second. Any questions or concerns about the amendments on Senate Bill 644? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concern on this Senate Bill 644? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Let's go back to page 1, House Bill 1189.
This bill establishes a Cyber Maryland program in the Maryland Technology Development Corporation, also known as TEDCO, to create a talent pipeline in cybersecurity, serve as a hub for state workforce development programs in cybersecurity, and generally coordinate cybersecurity and research and innovation in the state. The bill creates the Cyber Maryland Fund and establishes and specifies the membership of the Cyber Maryland Board. Beginning December 1st, 2026, the program, in conjunction with TEDCO, must submit an annual report on the operation and performance of the program to the Governor and General Assembly. With the amendments that I'll describe, beginning in fiscal 2025, the governor may include an appropriation in the annual budget bill of $250,000 for the fund and must include funds to cover staff for the program. The amendments on page 11 in your packet add for-profit corporations to the list of entities authorized to receive grant funding. That piece conforms this with the Senate bill. And then new amendments that would be offered on both this and the Senate cross-file authorize rather than require the governor to include an appropriation of $250,000 to the fund and specifies that the fund shall be used for the U.S. Department of Commerce talent pipeline management approach only to the extent that there is funding in the budget.
Okay, Rosenberg. Who is it? Kerr, Delegate Kerr.
We had some questions about the appropriateness of the for-profit corporations that were answered to the subcommittee's satisfaction, and was unanimous in subcommittee. I move the amendments.
Been moved. It's been second. Any questions or concerns? Seeing none, those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended.
Move the bill as amended.
It's been moved in second. Any questions or concerns or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? All right, the bill passes. Who does not want to be on the bill? Raise your hand. Delegate Shalega, Delegate Riley, Delegate Hutchinson, Delegate Morgan, and Delegate Chisholm. Okay? Yes. And the SB 801 is the same. May we go to that? That's the last page of the package. And that is Lindsay again and Delegate Kerr.
And that would be amended as I just described the House bill,
It's favorable. May I have a motion?
with amendments.
With amendments, it's with amendments. May I have a motion? All right, it's been moved and second. Any questions or concerns about the amendments? Seeing none, all those in favor say aye. On the bill, any opposition? Seeing none, on the bill as amended. Moved and second. It's been moved and second. All those in favor say aye. Any opposition? Seeing none, the bill passes. Let's go back to page 1, and let's go to Senate Bill 145. That is Lisa and Rosenberg.
There is an amendment on page 10, and with that amendment, the bill is identical to House Bill 103, except that it refers to the new license as a conditional license rather than a temporary license.
Okay. Rosenberg.
Go to the House bill.
All right. So is there a motion?
So move.
All right. All those in, is there any? He moves the amendment. So we moved in second. Discussion, Delegate Olston.
I just had a question about the amendments. So we're conforming to the House bill, so that means all the advocates that came in who were requesting the additional licensing, we're not doing that, and are we doing the study piece? So,
Delegate Collison will explain it.
okay, thanks.
Thank you, Madam Chair. There were too many uncertainties about naming a temporary license without any conditions under which it would be, and standards under which it would be granted. So we put that in 871 as part of the study with a constrained timeline that they have to come back to us by December 1 with a recommendation around the things that, the most compelling parts of the arguments around temporary license, the use of the exam, and the payment for supervision.
Okay. Delegate Rosenberg.
And consistent with what the Vice Chair just said, we added an additional reporting requirement in September so that we and the affected community would be aware, and this is a way to prod the board to really, to push the study along.
And this is a compromise, Delegate Olston, because as you know, we had passed a bill that we all voted on, right? And it was changed in the Senate. So when it came to us, we weren't part of that process. So this was a compromise because the report will come back in December. We're gonna have 3 reportings, preliminary, interim, and final. And we also added a member of the Black Caucus from the Senate, a member of the Black Caucus from the House, and we also added the NAACP and NAACP as well to the discussion. It's a matter of the next 7 months in order to get it right. Okay? My pleasure. Anyone else? Delegate Hill.
Thank you, Madam Chair. I just would ask either the Vice Chair or the Subcommittee Chair just to clarify for the members of the committee that this is one of 2 bills. And all of that was just discussed, was not all in 145. Some of that is in 871, so maybe you could clarify that.
Thank you, Madam Chair.
I'm sorry, I just got fantastic news, so
Oh,
I'm not gonna share right now, but go ahead.
So these two bills have always been seen as sort of companion bills. So what we tried to do with 145 is to be very clear around the definition of conditional license, which had been an outstanding issue for the last 3 years. And we took the other issues that were raised during the hearing and tried to address them in a very clarifying and transparent way in 871, which we'll talk about shortly.
Okay. Look, it is not what anyone wanted, right? Perfect, right? But given that we have less than a week left, this is not a bad compromise when we have a study and when we're going to come back. And when we make sure that people at the table were diverse and represented so that they can have a voice, right? And we're committed, like this committee is committed to doing it. And you know we're gonna do it. And we're gonna do it in a smart way, right? With everyone involved. So I thank you for being willing to trust the process and for letting us work it out, okay? But we are committed to it. Any other questions or concerns? Seeing none, the amendments have been moved and second. Any other concerns? All those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. And thank you all involved. I know you have been working on it for the last 3 years. Delegate Bagno and Delegate Collison and Lisa, who has a lot of gray hair because of it. Thank you very much for doing that. Yes. We can do A71 now. Thank you for the suggestion. I welcome it. Let's do A71, please, because we have to go vote. It's 1:35, and that is the last one on the package. Lisa and Rosenberg. Senate Bill A71.
Oh, sorry, okay.
I have the wrong one again?
I was confused, you jumped.
Yeah.
Okay.
Senate Bill 871.
Okay, so Senate Bill 871 is the bill that everyone was just talking about. There are amendments on page 25 of your packet. The amendments changed the notice for completion of an application from 10 days to 15 business days. They require the Senate and House members of the work group to be members of the Legislative Black Caucus. They add to the work group the executive director of the board, the director of the governor's office of deaf and hard of hearing, and a representative of the NAACP. And instead of a representative, Gallaudet requires a social worker who is deaf or hard of hearing. The amendments also authorize the work group to establish subgroups or contract with an entity that has expertise in analyzing assessment bias. The amendment requires the work group to determine by December 1st, 2023, whether the state should continue to use the examinations, whether the state should issue temporary licenses, and how to provide supervision at no cost to bachelor social worker and master social work licensees. There is a preliminary report due by September 1st, 2023, and a final report is due by December 1st, 2024. The final report will examine all of the licenses issued by the board and make recommendations to eliminate bias and make the process for licensing social workers in the state more fair, diverse, and efficient. And the amendments specify that this is an emergency bill.
Okay, so on the amendments have been moved. And second, any questions or concerns on the amendments? All those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. Is there a motion? Is it moved? It's been second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's go on now to, one second, Senate Bill 154. And that is Aaron and Bagnall, and it's favorable.
The bill requires the Maryland Department of Health to develop and implement a public awareness campaign to encourage the use of mental health advanced directives in the state. Behavioral Health Administration and the Maryland Healthcare Commission must jointly study how first responders and behavioral health crisis providers can access the advanced directives database when responding to a behavioral health crisis and report to specified committees of the General Assembly by December 1st, 2023.
All right, the bill has been moved. Second, any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's go on to Senate Bill 404, and that is Aaron and Collison.
And that's identical to its cross-file, House Bill 333.
It's been moved in second. Any questions? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, Senate Bill 404 passes. Let's go on to Senate Bill 601, and that is Lisa and Collison.
So this bill is identical to House Bill 814 with the exception of a technical amendment that the Senate put on, so we have no amendments.
It's been moved. It's been second. Any questions? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Shalega, Delegate Chisholm, Morgan, my brain is slow. Delegate Riley and Hutchinson, okay? Sorry. Okay. Let's move on to Senate Bill 622.
Identical to House Bill 1149.
It's been moved in second. Any questions or concerns? And so that we're clear, this basically, this bill allows all the waivers to share the money, including the autism waiver. The autism community wanted this, and the disability community wanted this, because there are autistic children that are in the other waivers as well. Okay, so, you know, they benefit from the other waivers, and they needed to have access, okay? All those in favor say aye. Aye. Any opposition? Seeing none. All right, let's move on to Senate Bill 626, please. And that is Aaron and Bagnell.
The bill requires the members of the Health Services Cost Review Commission to be appointed with the advice and consent of the Senate.
All right, any questions about this bill? And the Healthcare Commission is, they're actually, the Health Services Cost Review Commission is supporting it. All right, it's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Let's go on to Senate Bill 724. 724 is next.
Okay, this is a departmental bill that alters the means by which a health insurance carrier must inform a member of the member's representative or the healthcare provider acting on behalf of a member of the carrier's adverse decision for non-emergency cases. A carrier must inform a member, the member's representative or the healthcare provider orally by telephone or with the recipient's consent by text, fax, email, online portal, or other expedited means. There are no amendments.
All right. All right, any concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on, please, to 725. And 725 is Lisa.
And this is another departmental bill that specifies that certain provisions of insurance law do not prohibit a life insurer, health insurer, nonprofit health service plan, health maintenance organization, or property or casualty insurer from offering or providing products or services in conjunction with a policy at no charge or at a discounted price under certain circumstances. The insurance commissioner may determine by regulation the types of products and services that may be offered, and there were no amendments.
It's been moved in second. Any favor, any objection? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's go on to Senate Bill 727.
This is a departmental bill that extends the termination date for the State Board of Physical Therapy examiners by 1 year to July 1st, 2025. No amendments.
Is it moved in second? Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to Senate Bill 728. Lisa.
So Senate Bill 728 extends the termination date for the State Board of Examiners of Optometry to July 1st, 2025. There are no amendments.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Senate Bill 731. Lisa.
This bill extends the termination date for the State Board for certification of residential child care program professionals to July 1st, 2025. No amendments.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Senate Bill 732.
The bill transfers the state coordinator for autism strategy from the Governor's Office of Community Initiatives to the Maryland Department of Disabilities. The bill also expands the membership of the Maryland Commission on Disabilities to include an individual with a traumatic brain injury. There is an amendment on page 13 of your packet that was adopted in Public Health and Minority Health Disparities Subcommittee that transfers the positions and the associated general funds to the Department of Disabilities budget.
Okay, are there any questions or concerns about this bill on the amendments? Amendments have been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. We are on to Senate Bill 773.
This bill requires the Board of Public Works by January 1st, 2024 to publish a model policy concerning the inclusion and use of liquidated damages provisions in procurement contracts, and requires each unit of state government, including a unit otherwise exempt from state procurement law, to adopt a written policy that is substantially similar to the model policy by July 1st, 2024. Each procurement unit must also maintain written documentation on decisions not to pursue liquidated damages. The amendments on page 14 in your packet require the board to consult with the Procurement Improvement Council on the model policy on liquidated damages, requires a unit to obtain the approval of the head of the unit if the unit decides not to include a liquidated damages clause in a contract, and for procurements at $5 million or more, when a unit decides not to pursue liquidated damages, they're required to obtain the approval of the head of the unit and maintain documentation on the decision not to pursue liquidated damages.
The amendments have been moved. Is there a second? Moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition on the amendments, on the bill as amended? It's been moved. It's been second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Let's move on to Senate Bill 805.
We did that.
Oh, we did that?
Oh,
No, we didn't.
Sorry, I'm,
We did 801. It's okay. It's okay. Look, we're doing this together. We're all in it together. So Senate Bill 805.
5 is substantive, it's almost identical to House Bill 1217, except the Senate added to the reporting requirements that MDH determine whether to establish a cap on reimbursement for biomarker testing. Additionally, there is an amendment on page 24 of your packet that makes a technical change.
Thank you. Thank you. So on the amendments, it's been moved. Is there a second? All right, any questions? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Let's go on to Senate Bill, actually, we're done, but can you please stay seated for a minute? We are done voting. Thank you so much for your patience, okay? Can you take us down? Thank you. If you could stay seated, and then I'm going to give you the bill assignment. Can you make sure that you get the file from Michelle? This is where things can sometimes get a little messy, so please get the file from Michelle. Make sure that, again, they're going to ask questions sometimes, that you pay attention to your bill when it's called. And make sure that you call, I don't care if you know it. And with all due respect, please call the LA, okay?